Kids who are suffering from depression and anxiety. Jaden Urban joins us now here in the studio. Jaden, does this increase the impact the wait times, I should say, for parents and kids who are making a trip to the ER?
I mean, Ryan, it definitely could, but Renown says they typically will adjust staffing and needs to kind of fit that volume. Now, Renown does say that when in doubt, if you do feel like that your child needs care, don't hesitate and rush them to the hospital.
We see a whole slew of different mental health visits, from very severe depression, suicidality, all the way to people who are psychotic and having some severe psychotic breaks.
But specifically, Renown's emergency rooms are seeing a specific spike.
We've been seeing higher rates of anxiety and depression amongst youth. Some will blame a lot of different things. I think social media has been something that has been very concerning to us.
The doctor recommends that parents limit social media and time on the internet as much as possible and to do more things outside. Getting inpatient care versus outpatient ultimately depends on the severity of the condition. Outpatient involves a lot of at-home treatment, which Dr. Benaron says should be the first method if your child is starting to feel depressed or anxious. It's when things get worse is when they should come to the hospital.
What I would say is when things start to feel out of control, when they feel fearful for their child's safety, when they feel fearful for their ability to care for their child, that is where we proudly step in and support them in that process and get their child to where they need to be gotten.
When deciding on how to care for your child dealing with mental illness, there are two options: psychology and psychiatry.
I think it is a wonderful interplay between the two. My mother is a therapist, so I have strong feelings that communicating about feelings in a process is really important. But I also have a ton of friends who are in psychiatry, and when that is needed, we don't take it lightly. People are not giving medications until they really, really need them.
For kids who are dealing with a psychotic break, the hospital does have the authority to put them under a 72-hour hold. But doctors say they only do that if they absolutely have to.
A last resort would be when we really feel that the parent and the child are really not working well together to the point where the decision may put the child's life at risk.
Renown says that they do believe the new Washoe Behavioral Health Center, which was the former West Hills Hospital, expected to open in 2 years, will help them in caring for kids. They also believe that they had more inpatient beds that would help significantly in the short term. Covering Health Watch, Jaden Urban, 2 News Nevada.